Hi everyone, we are Group 6 and our project focuses on improving healthcare access for older adults living in rural areas of Central Africa. Population aging is a growing global trend and Africa is no exception. While more people are moving to cities, older adults are often left behind in rural areas. This happens for several reasons. Older adults tend to have low geographic mobility. They prefer to remain in familiar communities and many even return to their home villages after working in cities. Unfortunately, healthcare access in rural regions is more limited than in urban areas.
Older adults in these rural regions face a wide range of health challenges. Chronic diseases like hypertension and diabetes often go undiagnosed or untreated. Many struggle with sensory disabilities and lack access to geriatric care and assistive technologies. Malnutrition is also widespread, worsened by food insecurity and reduced physical ability to grow or access food.
Healthcare access is blocked by several key barriers. Long travel distances, lack of transport, and financial hardship make it difficult for older adults to visit clinics. Cultural and social factors, like mistrust of formal medicine or reliance on traditional healing, can delay or prevent people from seeking care. And with limited digital access and climate disruption, many can't benefit from health education or remote services.
Many rural clinics in Africa are under-resourced. Over 50% lack electricity or clean water. Clinics are often poorly constructed, understaffed, and depend heavily on NGO funds. Climate change exacerbates this health risk. Older adults are especially vulnerable to extreme heat, which can trigger dehydration or worsen existing heart and lung conditions. Floods and droughts disrupt access to clean water, spread of diseases like cholera or malaria.
Telemedicine offers a potential solution. Telemedicine can reduce travel, save time, and provide easy access to doctors remotely. AI can also be used to predict disaster zones and for triaging patients remotely before they reach a physical healthcare facility. But challenges remain. Many rural areas have unstable power and network, and also some older adults can struggle with understanding digital tools and understanding medical instructions that they receive remotely.
In many communities, illness may be attributed to spiritual causes, leading people to turn to traditional healers. Community health workers can bridge gaps between biomedical care and local beliefs, especially during climate crisis.
Currently, there are several home gardening and nutritional counseling programs working toward bridging this gap. They are evaluated by Burkina Faso and Kenya, and they aim to create biodiverse gardens and promote nutritional messaging, as well as being cited as a climate-resilient adaptation model. However, few programs have rigorous impact assessment and receive weak political support. Scaling up will depend on stronger institutional and political backing.
Our group proposes 4 key recommendations.
Strengthen infrastructure and health systems. We need durable, low-emission health facilities that can withstand floods, droughts, and extreme heat. Urban planning should support safe walkways and accessible public transport to connect remote areas. Reduce emissions and promote active lifestyle. Train healthcare workers in emergency response. Climate health surveillance and digital tools will also ensure that services remain available during crisis.
Governments and NGOs can support telemedicine and digital tools by providing free Wi-Fi hotspots, expanding wireless and satellite coverage in rural areas, providing subsidized data plans and loaner devices, and by introducing electronic health records, mobile surveillance systems, and decision support apps. Community-led digital literacy training and the promotion of digital health champions will help ensure these technologies are accessible and trusted.
Policies must align with climate goals while protecting vulnerable populations. We recommend enacting net zero emissions targets and supporting climate-resilient infrastructure, deploying early warning systems tailored to rural communities, prioritizing environmental justice by directing resources to historically underinvested areas, and supporting global partnerships for disaster response and climate financing.
Empower communities. We recommend supporting local NGOs and organizations in resilience planning, establishing community-based disaster teams trained to respond to local climate events, providing culturally relevant health education, and implementing monitoring and evaluation systems to track progress and adapt strategies as needed.
A whole-of-society approach is key to protecting older adults in a changing climate.
In conclusion, to protect rural older adults, we need climate-resilient infrastructure, digital inclusion, culturally appropriate care, and strong community networks.
Thank you for watching our presentation.